So that's right, takes effect in Mombasa today, and that is where Tobias Chanji is speaking to union officials from the coast region. Tobias Chanji, good morning. So talk to us about the effect of this strike on public hospitals at the coast and the grievances that the health workers have.
A very good morning, Brenda. We are coming to you live from the Coast General Hospital in Mombasa. This is the largest public hospital in the entire Coast region. And as you can see, what is happening here is that the place is deserted, save for a few people who are coming in to just check on their dear ones that were admitted previously. Now I'll be speaking with the union official, that is KNUN Union of Nurses Secretary Mombasa County branch, that is Peter Maroko, maybe to just delve much further on the matter. But just remember that we're having two kinds of strike in the Mombasa County. There's this strike that is kicking off officially today that has been we've been told it's due to lack of PPEs and other issues, while there's a previous strike that is entering fourth week now, issues to do with the remittance of money on loans and also the NHF. But let's just allow him maybe to talk to us on other issues that have done, or rather have made them to go on strike.
Yeah, as you heard, my name is Peter Maroko, the branch secretary in Mombasa. And actually we have two strikes in one, because we've had a strike that has been ongoing for the last 3 weeks. This is the fourth week, whereby we served Mombasa County with a strike notice on two issues. These are salaries and remittances. Still, as it is, the salaries for the month of November is yet to be paid, and also the remittances, the county was only able to remit only 1 month, that is the month of July. So far, we've had a single engagement where the county government of Mombasa was able to engage us in a discussion, and they gave us a proposal to return to work. But that proposal did not really capture our issues as we intended them to be. And therefore, due to this, we wrote back to them a counter proposal that was actually meant to actually demand that they do one or two things. And in that proposal, we said that the county government should be able to pay at least 3 months, because we had all 5 months in arrears. So far, as you have said, it's only 1 month they have been able to pay. Secondly, we had also asked them to engage the institutions that they owe money to. That is NHIF, banks, and other institutions like insurances, which we had demanded that they engage them and have a certified commitment that they are not going to penalize our members. So far, none of this has been done, and therefore we continue with the local strike and also the national one. On the national strike, the major issues that we're asking for is that we want the national government and the counties to engage us and actually come up with a resolution on the demands we put forward. And this is about a risk allowance, which we have demanded that the county government of Mombasa pays us 30,000, not less than 30,000 in risk allowance. And then it gazettes also the COVID-19 as an occupational disease. Of course, we are aware that this has been done, but no much has been done to ensure that our colleagues that succumbed to COVID-19, their families get compensated. And therefore, still that part, even if it has been declared an occupational disease, not much has been done, because our families, the families that lost their loved ones to COVID, are yet to be compensated. You heard yesterday the government saying that they have paid some of the health workers working on contract, which is untrue. We have contracted staffs here in Mombasa that have not been paid for 6 months, and they're still working in isolation centers, some of whom have even contracted the disease, or the COVID-19 disease, and yet they don't have salaries. You saw one of our doctors died in Nairobi, and then the government, without any shame, they released a pay slip that has not reflected in terms of payment in the account of the one of our colleagues who's accompanied in Nairobi. That is so uncaring of this government we have.
So talking about the first strike that has now gone for an entire month, did you serve maybe any notice to the county government of Mombasa, and what reactions have they maybe?
Yeah, the strike that is ongoing here in Mombasa is legal. It was well served to the county, received and stamped by the county government offices. So the county government of Mombasa is much aware. The problem that we're having with Mombasa County is that they are very reluctant. They are not bothered with what is going on. because you see the kind of suffering that is going on among our patients here in Mombasa is uncalled for, because if at all our government here in Mombasa is also caring, it would have engaged or it would have paid the remittances we are demanding for so that we can come back to work. So the problem is that the county government has neglected its duty to engage us or to pay the remittances we are demanding for.
How many health workers have stayed away?
Yeah, so far we are all cadres except doctors. I mean, even doctors, yeah, I'm sorry. Doctors joined the strike yesterday. They also served a strike notice for 7 days, and they are currently on strike. The Mombasa County doctors are on strike also. So, generally to say is that all health workers are on strike here in Mombasa.
So, do you see any possibility of coming to work any soon, especially with the first strike?
I don't foresee much because, as I've said, that the county government of Mombasa has not really been able to engage us in any meaningful discussions on the matter of the strike we had served them with a notice. And there were only 2 issues. We did not raise much. We know we have issues to do with promotions, which they have not fully done, because there are appeals we made. They accepted those appeals, and they haven't actually actualized those appeals. So therefore, there's still issues to do with the promotions that we did not capture in our strike notice. And therefore, because our national strike still captures the issues of promotions, we therefore bring these other issues that we did not capture them in our initial strike into the other strike that is national. So that now all these issues are addressed wholesomely and holistically, so that we are able to have a meaningful or resolutions that will enable us to go back to work.
Okay. And for now, what is happening inside there, and what do you have to tell the patients?
I know a majority of our patients here in Mombasa are going through untold suffering. I know we have patients who have COVID, we have patients who require to go undergo surgeries, there are patients who are due for chemotherapy, and they cannot be attended to. So we are losing patients who would not have even died if at all they were attended to. There are patients who would be having maybe surgical emergencies that require surgeries. These patients are still suffering back at home, and therefore I'm very sorry to say that from my own personal view is that we shouldn't be here where we are. But unfortunately, we have a government that does not listen, a government that waits, that wants to flex muscles first before they yield. That's the problem we're having, that they would want to flex their muscles with us before they yield to any of our demands.
Now, lastly, those who are being treated of COVID-19, how are they coping?
I know a few of our colleagues, especially the contracted staffs, are attending to the patients with COVID, and we have also volunteers whom we have not bothered to actually call out of the working stations, because we know they are serving humanity because of the areas they are attending to. Like in our NBU, that's newborn unit, ICU, and isolation, we had suggested that at least we have our colleagues attending to. But unfortunately, because our members are really going through a lot of untold suffering because they cannot afford anything in terms of bills that they are incurring back at home. And therefore, we were unable to influence them to go back to those areas. And therefore, those few are attending to the patients, we allow them to proceed. But the unfortunate thing is that they are unable to attend to all patients at once. And therefore, majority of the patients who need our care are actually suffering back at home.
Okay. Thanks a lot, and all the best. That is Peter Marocco, who is the Secretary, Mombasa Sector Branch of the Kenya Union of Nurses, just explaining to us the situation as it is happening currently, not only at the Coast General Hospital in Mombasa, but the entire public hospitals in Mombasa County. And remember, as he said earlier, I've been having 2 strikes at a go in Mombasa, one concerning the remittance of loans and NHIF by the health practitioners, while the other one is the national one that has just kicked off today officially. Back to you in studio.
Tobias Chanji, thank you so much for that report. I know you'll give us more details because it is a developing story here in the country. But meanwhile, the medical fraternity is mourning the death of one of their own, 28-year-old Stephen Mogusu, who succumbed to COVID-19 related complications. The latest death brings